Hey guys, welcome. This is Dr. Izabella Wentz. I'm really excited to have Dr. Lisa Koche with me today. Dr. Lisa Koche is a medical doctor who has always focused on finding the root cause of complaints instead of just treating symptoms with medications. She actually has a practice in Tampa, Florida called Spectra Wellness, and they use cutting-edge methods to treating illness, and they're dedicated to utilizing the best of both traditional and integrative medicine to allow patients to achieve optimal health and well-being. They have a team of providers who work together and use different modalities to ensure a quick and accurate diagnosis and treatment plan. Dr. Koche is triple board certified in internal medicine, anti-aging, as well as bariatrics. So welcome, Dr. Koche. It's so nice to have you here.
Thank you for having me.
I know a lot of us kind of come from the traditional world of medicine or, pharmacy like myself. Because of our own personal health journeys, I was working as a consultant pharmacist when I was diagnosed with Hashimoto's, and I was kind of one of those people that was saying, natural medicines are not really things that work, they haven't been tested, and so on and so forth. And it wasn't until I tried things on myself is when I really became an advocate for basically using integrative medicine, where you take the best of both worlds, taking the most effective medication and diagnostic options, as well as some of the natural medicine options to really help a person get better. Because in the end, that's pretty much what people are looking for. They want to feel better. So how did you get into integrative medicine?
Well, that's a fantastic question. Similar kind of story. I was actually ill as a teenager. I was diagnosed at 15 with leukemia. I went through 3 different years of pretty hardcore chemotherapy, did well, responded. So at that time needed traditional medicine. My family wasn't opposed to more natural, but didn't really have a lot of experience in it. And then I had to have actually 2 more years of chemo in college. So had a lot of high doses of medication and was able to recover and felt like I was doing pretty well until I got pregnant, was able to get pregnant, which they didn't even know that would be possible. Some of the chemo had affected my heart, so they watched me really closely during pregnancy, and I did okay. And right after I had my daughter, and she's doing great, she's now 12 years old, I had an immune crash, and that was about a year out from my pregnancy. My thyroid and Hashimoto's titers kind of registered off the charts. So I was very hopeful that was why I was suddenly feeling so exhausted, and took traditional treatment with different kinds of thyroid medication and corrected my blood work and did not feel better. And I was already out of the box because of my prior exposure to traditional medicine. I was already asking why a lot of times in my practice. And then that episode really pushed me the rest of the way into the integrative path and teaching myself integrative medicine.
Wow. So you actually had leukemia and then you had Hashimoto's.
Yes.
So you were able to overcome 2 very, very different conditions.
Yes.
Can you tell us, the listeners, a little bit more about your Hashimoto's journey? What it was brought upon by pregnancy, as often that can be a trigger for people. And what kind of symptoms were you having?
Well, I had a new baby, so I was tired and I didn't really pay a lot of attention to it, but I was also a lot of foggy brain. I was bloating. I was cold all of the time. And probably those were the biggest symptoms. I also had some allergy symptomatology, sinus issues, and psoriasis that kind of popped up at the same time.
Wow, it's all kinds of things were happening all at once. It almost feels like your body is falling apart and you're not quite sure what's happening. So, a lot of us will go the traditional route, but as many of my readers and listeners will say is, you will try all these things, you'll get your thyroid levels optimized, you'll get on the right medications, but you still don't feel well. And you do everything that the endocrinologist or, your primary care doctor tells you to do, but you're still not feeling better. So what kind of additional interventions besides the thyroid medications did you try that helped you get better?
Well, I feel for your readers because, and your listeners, just because I went to an endocrinologist. I said I was going to be a good girl and follow through. My OB wanted me to do that. And they recommended, here's your Synthroid and follow up with my nurse practitioner in 6 weeks. For a TSH level. So I kind of was like, I can check my own TSH. That is not what's wrong. So I ended up pursuing all these alternative treatments, which included everything from nutraceuticals to working on my gut to, all the way over to energy healing and some different kinds of newer approaches that I'm looking into now.
Wow, it's amazing. So what do you think was the most helpful intervention in your experience? I know everybody's different, but for you personally?
I would say intervention-wise is almost more of a diagnostic tool, which is kinesiology. I don't know if you've ever experienced that, but I found a healer that is now one of my partners in our comprehensive clinic, who was able to find some of the causes behind my Hashimoto's, which were literally chronic fatigue viruses, leaky gut, yeast, you name it, and we were able to kind of crack through and heal all of those different triggers, utilizing kinesiology and muscle testing as one of the main diagnostic tools.
Can you explain to us a little bit how kinesiology and muscle testing works?
Sure. I'd like to explain to the patients that we have our physical body and then we have an energy field around our body. Other cultures get it. They work on it all the time. They work on their chi and their chakras, and we kind of ignore it, and instead we hammer it with Wi-Fi. So there's a connection between the energy field and your physical body, and it can be seen in a reflex. So I tell my patients at home, take your arm, push on it, have somebody at home push on your arm, and you'll be strong. And then hold something in your energy field that maybe is negative, like a cell phone or a packet of Splenda, something that we know isn't good for your energy field. Hold it up next to your body, and literally a weakness is elicited in your muscle, your proximal muscle in your deltoid, and you have that person push on your arm again, and you will not be able to resist it. It's a pretty powerful thing when people see it, because I let them know you could be, the Incredible Hulk, or you could be a little old lady, and it's really a reflex. It's not a statement to how strong you are. So we utilize this technique, which is not evidence-based. So that's something that people kind of have to go with, because it is an integrative approach that doesn't have the science behind it yet, but it can fill in the gaps, because we can use that same technique to test on people, basically test the patient on themselves. So we can look for reactions and patients going weak over their thyroid, or patients going weak to certain virus energy frequencies, and then we can go through and try to test also what's going to help heal it.
That's amazing. And so just to clarify, you have a practitioner that is trained in this, or do you have patients do it on themselves?
Great question. And it's done predominantly through a practitioner who's done this for 40 years. So he's a real guru. He connects everything with a huge knowledge base of anatomy and physiology. Patients, I like them to just on themselves, just see that it works, and it's not just a kind of a magic trick, because that's what it looks like when you've not been exposed to it before.
Yeah, I think it's really important to find a practitioner that really knows what they're doing with this, and that has a lot of really great experience. And you can see the results in yourself. I mean, I've had it done, and it's just amazing, where sometimes you're holding something and it's just like you have all this resistance, and then other times, somebody's pushing your arm down and it's like you can't even put up any resistance. It's amazing how that works. And if you have the right practitioner, it can be very, very helpful in trying to figure out what some of your root causes are. So once you were able to kind of figure out what some of your triggers were and root causes, what kind of results have you seen with yourself and your Hashimoto's?
Well, I mean, my TPO titers on diagnosis were not measurable. They were over the lab limits of 1,000 or whatever they were. They're now 100. I'm going for 0, but we're not quite there yet. So they've come down dramatically, and physically I just continue to get stronger and stronger and feel more vibrant every kind of step of the way.
Yeah, it's just amazing when you can get those antibodies down. I know mine were like in the 2,000 range, and it's just, I like to think of it as progress, not perfection. So the lower the antibodies are, the less aggressive the attack on your thyroid is. And then that gives your body an ability to regenerate and heal. And, I've heard somewhere, and I don't know how true it is, maybe this is your experience with your patients as well, that for every year that you've had these chronic conditions, it may take you a month or even longer to heal from them. So once you get rid of an infection, a chronic viral infection or something like that, it'll take your body some time to recover from it. Is that your experience as well?
Sure. The longer you've had immune system, especially leaky gut, more toxins have been able to get in the body, so the healing time may be prolonged. But I don't know. I wouldn't say that definitively because we've had some pretty sick folks be able to turn around over, it's not going to be tomorrow, but over maybe a 3, 6 month, 9 month period with pretty significant results. And I think some of the lag time is more the inability to have adequate diagnosing for the root causes just because it's not out there in traditional medicine.
It's just amazing when you can do some things, kind of out of the box things for people that have been exhausted for 10 years. Mm-hmm. And then you see them improving within like a 3-6 month period of time. It's just amazing to hear those stories from patients and clients who have gotten their lives back. What's been one of your favorite stories from your patients?
Well, I've had many, but probably one of my favorites was a guy. It was actually a young man who came in who was 22, and he had autoimmunity, Hashimoto's, and was diagnosed with schizophrenia, and he was unable to eat. So he had a pretty significant severe leaky gut, and he had tried all these different kinds of medications, and him and his mom had decided that his problem was more immune system mediated, and we turned his gut around and got his thyroid levels down, or his antibodies down, and he's totally functioning human being. He gained normal weight back. He has a job. He does not have schizophrenia. He just had brain inflammation from all the inflammatory processes going on in his body. So he's probably one of the more impressive turnaround stories.
And that's just amazing because you've given him his whole life back. If he had been placed on medications for schizophrenia, we know how devastating these medications can be on just about everything. They of course, they help people who are very, very sick, but if we could find the triggers for why schizophrenia happens, we can give somebody their life back. So I love that story. Thank you for sharing.
Absolutely.
So I know for you, Hashimoto's was kind of a gateway to learn all aspects of healing. And it's kind of interesting because you were able to learn with yourself, but also with all of the collaborators that you've worked with and your patients. Can you talk a little bit more about that?
Sure. I think along the healing path, it's always a journey. And really, once I started getting myself healed to a certain level, then I was ready for the next level because I don't think it ever ends. And then I would meet these different types of healers, and the ones that really resonated with my own personal healing, I kind of took as a sign it was somebody that I needed to share, either a technique or a person that I needed to share with the rest of my patients. And I started to develop the ability to identify patterns, and have now been able to group it into 3 main healing aspects, which is the physical piece, the structural piece, and then a mind-body energy piece. So we try to address all 3, and the physical is kind of more of getting to the root causes, toxin, leaky gut, infectious etiologies, those types of things. But what I was finding is that maybe I got myself where that was all cleared up, and a lot of my patients were even on muscle testing, nothing was showing up as much anymore, but they still were tired. Or maybe they still had a little bit of sleep issues, or still some anxiety, or still infertility. And so then I started looking outside the box again, and I found something very powerful, which is a chiropractic adjustment that we utilize using a sound wave. And there's no hands on the neck. It's all done with a very precise instrument to adjust the very first bone in the neck back into alignment. And we've seen dramatic improvement in autoimmunity and a whole host of other issues, because when that bone comes back in, the signals to your body are more connected, the blood coming to your brain is more connected. So that was about maybe 5 years ago, got exposed to that piece of the healing process. And I've seen people whose blood pressure have stabilized. I've seen it help with thyroid disease. I've seen it help things like plantar fasciitis, and you get their neck back in, and then their foot's better. So we don't really, we don't understand the nervous system to the level, someday we will. And then the third piece, which is the mind-body, is so powerful for everything, especially autoimmunity. We start doing a lot of work on kind of where's your thought patterning, and journaling and meditation, and some other energy healing techniques like Reiki and Jin Shin Jitsu. And what I found was that if patients didn't have their C-spine in alignment, they could try to do all this meditative / energy mind-body work, but the C-spine was the gateway between your energy field and your physical body. And if it wasn't in where it needed to go, the purging and the clearing wasn't happening the way that it needed to.
Wow, so that's amazing. So basically you found that we need to get our ducks in a row and not just focus on the physical, and then not just focus on, some people will just focus on the emotional part and they think that this will be it, but you also found that alignment is very, very important.
Yes.
Wow.
Yes.
Amazing. What do you think are some of the most common misperceptions about thyroid disease?
Well, I mean, I think everybody wants it to be a problem because they feel like it's an easy fix. So I'm sure you've heard that one before. And then when we get the labs and they're so disappointed that the TSH is normal, and I think that that's one of them, just kind of the lay public or even doctors to some degree, you know, we want that to be a problem because it's easy to fix pharmaceutically, at least from a lab perspective. But then the other is just the blood work. So, you know, people come in and the full panel has never been drawn. So I think that, you know, thinking that TSH is the only thing that we need to look at is obviously a misperception. And I would say also how common it is. I don't think people realize that it's, you know, such high percentages of people today that are suffering with thyroid problems.
Mm-hmm. Yeah, I'm doing a literature review right now, and then some studies will say that as many as 20% of people will have the circulating antibody for thyroid, for autoimmune thyroid disease. And that's just amazing because that's 1 in 5 people. And some people may not have an abnormal TSH, but the thyroid antibodies are associated with symptoms too. So a person may actually have irritability, they may be more tired, they just may feel kind of unwell, a general feeling of just something's wrong when they have these antibodies on board. So thank you for being one of the doctors that actually will look at a person from a comprehensive standpoint. So really appreciate the work that you do. I am really curious to learn about your team approach to health that you have in your clinic. Can you share more about that?
Absolutely. So we've tried to kind of combine a lot of these different aspects that we've briefly mentioned into a 90-day program called the Koche approach. And it's a way to kind of coach people back to vibrance and empowerment and healing. And it involves a fairly restricted dietary plan because, as you know, gluten and inflammatory foods definitely can rev Hashimoto's, but along with a bunch of other issues as well. So we do detoxification, we heal the gut, we balance adrenals and insulin, and we get patients on the right thyroid support and look for hormonal imbalances. And then I'm really embracing a ketogenic type of a dietary approach. I think that's where it's at for me personally, because there have been some interesting studies on being in ketosis for several weeks at a time, being able to increase the production of mitochondria, which is very exciting for any chronic issue. So from a fatigue standpoint, from cardiac function standpoint, from autoimmunity, I really think that that's going to have some interesting research support as we go forward. So we're doing some clinical studies in the office right now on ketosis, and that's the dietary piece of the program.
That's wonderful. I'm actually a big proponent of ketosis. Being on a ketogenic diet was one of the things that really helped me feel better. I felt calmer and I felt like I just had a lot more energy. I know it's kind of a controversial topic in the thyroid world, and I know we'll get a lot of questions, but I'm actually a proponent of ketosis for thyroid. I think there's a lot of misconception out there that it can alter some thyroid hormones and some people may feel more tired. But what I found is a lot of times people may need some digestive support or detox support. And those may be some of the barriers that people may not be doing as well on the ketogenic diet. But it's a wonderful healing modality for a lot of things. And can be
I agree. And what I found is that it cannot be done just on the fly. So we're monitoring patients weekly. We're monitoring their thyroid function. We're providing additional selenium and other nutrient support, which I think is part of what potentially happens in ketosis during the transition period. It's really the keto adaptation phase, which can last up to a couple of months. So we are kind of hand holding the patients and we're collecting data. We hope to kind of publish a lot of research on this in the future.
I can't wait to see it. I'm so excited.
Yeah.
That's wonderful. So that's really great that you're doing that. And then you also have a mind and body piece in your program as well. Can you tell us more about that?
Yeah, well, we kind of alluded to some of the energy healing capacities when you really work on the body energetically with meditation. And part of the program that's very big is a combination of meditation and journaling. And the journaling that I recommend to the patients, first of all, has to be easy and quick. It also has to resonate with men and women, and it's pretty straightforward. So I have patients at night kind of invite in positive energy, embrace being healed, and they write, I am healed, I have a totally functioning thyroid, I feel great every day, I'm a normal body, healthy body weight. And in the morning I have them purge, so it's a fresh piece of paper, and they kind of, whatever needs to come out, they write it, then they take it, tear it up, throw it out. And on both ends, after doing the writing, is a visualization technique of picturing yourself totally healed, doing something active that maybe you cannot do right now, and putting that into a snapshot in their mind. And that's very empowering. The whole program that we have is coaching patients to become empowered. So feeling that they're healed already really helps the process along.
You know, and I love that. And I use those kind of mantras when I was going through my journey too. And I thought that they really helped me. And I pictured myself with, you know, one of my symptoms was losing a lot of hair. And I had this short, very thin hair. And then I pictured myself with lots and lots of hair. And eventually it came true. And it's just amazing. If you can picture something, it's like you can do it. It just makes it, it's just amazing what our minds can do.
Absolutely. And I mean, for me, you know, on top of the Hashimoto's, I had heart failure from chemo. So for me, it's always been crossing the finish line in a 15K. And I mean, you need to know, what I tell people is the more detailed, like you said, big, beautiful head of hair. I know what I'm wearing. I feel the sweat. I can feel the wind. I hear the cheering. So the more detailed the picture is energetically, the more likely and the sooner you can bring it to fruition.
Wow, that's amazing. I think that's a great takeaway for people listening to us today, is to start doing that in their own homes. People in the Florida area, what they can actually come to see you in your clinic. Is that right?
Yes, we have this weekly program. It's a 12-week program called the Coach Approach that we're happy to see anybody who's in the greater Tampa Bay area. Right now we're just operating in one clinic, but we may be opening some satellites. And I have a book that's 3/4 of the way done on this this approach, and so we're excited about that, and eventually hoping to get it all onto video for a course and a program that people can just purchase and do at home.
Okay, so I love that. So I know one of the biggest questions I get is where can I find a doctor that actually looks at the root causes of my condition and will really treat me from a comprehensive way. So, you know, for everybody from Florida, Dr. Koche, she's in Tampa, and your clinic is called Spectra Wellness.
Yes.
So you can check her out there. Eventually, you'll have this information for people that, you know, if they live all over anywhere in the world, they'll be able to get this information for themselves.
Absolutely. We're shooting for hopefully within the year, maybe even sooner.
Okay, well, I'm so excited about that. Before we let you get back to your patients, any kind of words of wisdom you have for people with Hashimoto's who are maybe kind of in the beginning of their journeys? What would you say to them?
I would say that they need to understand how empowered they already are because they found you. So they are strong enough to look outside the box, which is awesome, and to believe in their own power to heal. And that, you know, the only thing we're going to do is continue to grow in our ability to diagnose and treat these causes as medicine continues to evolve.
Well, thank you so much, Dr. Koche. It's been such a pleasure to have you. Thank you so much for the work you do.
Thank you for having me.
Take care.
Take care.